We've all experienced pain. It's an unpleasant but essential part of life. Pain tells us when something is wrong, prompting us to protect ourselves. Luckily, we have pain relievers. These readily available medications provide relief from minor aches to serious injuries. Pain relievers, also known as analgesics, work their magic by interfering with how our bodies perceive pain. Imagine pain as a message traveling from the source of injury to our brain. Pain relievers interrupt this message along the way. This interruption means our brains don't receive the full message of pain. These medications are like the everyday heroes of the medicine cabinet. They help us power through headaches, soothe sore muscles, and recover from injuries. Understanding how these pain relievers work can help us appreciate their role in improving our lives. Not all pain relievers are created equal. They come in different categories, each with its own way of tackling pain. NSAIDs, or non-steroidal anti-inflammatory drugs, include familiar names like aspirin and ibuprofen. NSAIDs reduce pain by blocking the production of prostaglandins. Prostaglandins are chemicals in our bodies that contribute to inflammation and pain. Acetaminophen, a common over-the-counter painkiller often known by the brand name Tylenol, works a bit differently. Acetaminophen is thought to block pain signals in the central nervous system, which includes the brain and spinal cord. Opioids, such as morphine and codeine, are powerful painkillers typically prescribed for severe pain. Opioids work by binding to opioid receptors in the brain and spinal cord, altering the perception of pain. Each type of pain reliever has its own strengths and potential side effects. Understanding these differences helps us make informed choices about managing pain safely and effectively. Imagine your nervous system as a complex network of roads. When you get injured, pain signals travel along these roads from the injury site to your brain. Your brain then interprets these signals as pain. Pain relievers work by setting up roadblocks or detours on these neural pathways. NSAIDs, for example, target the production of prostaglandins, which are like messengers that amplify pain signals. By reducing prostaglandins, NSAIDs lower the volume of these pain messages. Acetaminophen, on the other hand, acts directly on the central nervous system. It's like a traffic controller in the brain, reducing the number of pain signals allowed to pass through. This action helps to dull the sensation of pain. Opioids take a more potent approach. They bind to opioid receptors in the brain and spinal cord. Think of these receptors as locks. Opioids are the keys that fit those locks. When opioids bind to these receptors, they change how the brain perceives pain, often producing a feeling of euphoria alongside pain relief. Section 4. Real-life analogies, making sense of pain relief. Think of pain signals like a group of runners carrying a message, "We are hurt," to the brain. NSAIDs are like obstacles in the runner's path, slowing them down and making it harder to deliver their message. Acetaminophen is like a gatekeeper at the entrance to the brain, turning away some of the runners so the message is weaker. Opioids are like tranquilizers that calm the runners down, so they are in no hurry to deliver their message. These analogies help to illustrate how different types of pain relievers interfere with pain signals, ultimately reducing the sensation of pain. Section 5. Improving lives, one less ache at a time. Pain relievers are more than just medications, they are essential tools that improve our quality of life. They allow us to function when pain threatens to slow us down. Whether it's a pounding headache, a stiff back, or pain from a sports injury, these medications provide relief, enabling us to work, play, and enjoy life to the fullest. However, it's crucial to remember that pain relievers should be used responsibly. Following dosage guidelines, understanding potential side effects, and consulting with healthcare professionals are essential for safe and effective pain management. By using pain relievers wisely, we can effectively manage pain and live healthier, more comfortable lives.